Hi everyone, this is Alexander Lim and welcome to AuthorStory, where on every episode we speak to various authors on various topics of interest. We have an interesting episode today because the topic concerns the healthcare system of the United States and what is apparently wrong with it, as well as what one can do to maintain one's good health despite all the brouhaha that presently surrounds it. Our guest is Dr. Martha Howard, who got into acupuncture after being healed by it after a car accident, and she has been a medical doctor for over 35 years now. She is the author of this week's featured book, Alive and Well, Your Survival Guide for the Healthcare Apocalypse. And you can check out her book right now by clicking on the Amazon link in the video description below. So, Dr. Howard, welcome to Author Story. Thanks lots for being our guest.
Thank you, Alex. I'm happy to be here.
Oh, fantastic, fantastic. So, Dr. Howard, what made you decide to write Alive and Well?
I just saw so many sick people around me, and I started wondering what in the world happened to health in America.
Mm-hmm.
When I was a kid, people were healthy, adults were healthy, they were slim, they were energetic. That was in the 1940s. And now, 60, 70 years later, oh my goodness, 1 in 3 people is obese.
Wow.
6 out of 10 people have at least one chronic illness, and 42% have more than one. So I started to think, okay, what has made that happen, and what can we do about it?
Okay. So, Dr. Howard, please tell us in your own words the story of when you decided to write Alive and Well. How does this relate to your journey of being in medicine and what others would call alternative medicine?
Well, what I call it is integrative medicine, and that means we use every tool available that we know will work. So I use Western medicine. I'm a family practitioner, an MD, and I use traditional Chinese medicine and also supplements, vitamins, minerals, that kind of thing. A lot of the basis of chronic illness is being deficient in vitamins and minerals. You can't eat junk food too long and not be deficient in something.
Okay. Of course, you started this off with acupuncture, as I mentioned earlier, right? You had an accident, you got into acupuncture, and that cleared things up. And how does this relate to you going to alternative and in being in medicine proper?
Well, what happened was I got in a car accident. Actually, the person was drunk.
Okay.
A drunk man hit my car, rear-ended my car,
Yeah.
and broke my neck.
Ouch.
Ouch. So, but that turned out to be a good thing, as those things often do, because I ran around and tried to get help from Western medicine, and they just said you have to live with it, or here, take these opioid painkillers. And I was, even in those days, and I was saying, no, I just won't do that. So I found an acupuncturist, and he essentially in 3 months fixed my neck. So I thought, oh my goodness, this is great. I've got to learn this. And I ended up doing a 2-year apprenticeship with him and learning acupuncture. All of a sudden, I realized, oh my goodness, now how am I going to practice this? Because I'm in the state of Illinois.
All right.
And they didn't allow anybody but MDs or DOs or chiropractors to practice acupuncture. So I said, okay, and I went to medical school.
Okay, so you went into conventional Western medicine in order to teach alternative Chinese medicine then.
Well, essentially, in order to practice Chinese medicine and in order to use the best of Western too. Remember, it still has things that work.
Right, definitely.
There's point in rejecting Western medicine, just throwing out the baby with the bathwater.
Right, right. Okay, so let's talk a little bit about your book. First off, in a nutshell, what is Alive and Well all about?
Well, I think of it as kind of a make it happen book.
Okay.
And it's if you want to feel alive and well, if you want to have a healthy life, you've got to make it happen.
Mm-hmm.
So I started thinking, what are all the forces that keep us unhealthy?
Mm-hmm.
What do you have to watch out for? And then what can you do?
Mm-hmm.
You know, what actually do you do every day? How do you prepare your food? Or how do you keep from your computer posture wrecking your shoulder?
Right.
Or how do you keep, how do you stop having things like plug in air fresheners compromise your breathing and your lungs?
Mm-hmm.
How do you learn about those things?
Mm-hmm.
And what do you do to positively affect your health?
Mm-hmm.
And it's interesting to know. I mean, it does say healthcare apocalypse, and I want people to know about that. But that's 39 pages
Mm-hmm.
of a 380-page book.
Right.
So most of this book is about what do you do to stay well?
Mm-hmm. Okay. Okay. So I think you've kind of explained this already, but Alive and Well, there are a whole lot of other books out there about health and keeping healthy. Uh, what, in your opinion, differentiates your book from others? Why, in other words, would someone think of buying it?
This book has the details and what you really need to stay healthy. And most importantly, it's based on thousands of patients and 35 years of clinical experience. The
Mm,
fact is the methods that are described in this book work, and
mhm,
they've worked over all this time for thousands of my patients who
mhm.
went from feeling kind of bad most of the time
Right,
with an occasional good day
right,
to feeling good most all the time with an occasional bad day. So, what a difference in your life. What a great difference that makes.
right. Okay. So, you mentioned apocalypse. Now, there's no doubt. I mean, I've like me, I've read a lot of news stories about healthcare system in the United States not that good, sometimes bad, and stuff like that. What do you have any statistics on how bad or good things are in the United States right now, healthcare wise?
Well, the latest RAND Corporation study, that's August 2017,
Mm-hmm.
says that 6 out of every 10 people in the United States has at least one chronic illness.
Chronic illness, by which you mean?
That's anything from arthritis to Alzheimer's, the allergies, Alzheimer's, arthritis,
Mm,
and mostly high blood pressure, diabetes,
mm,
and heart disease,
mm.
lung disease, chronic obstructive pulmonary disease, all
Right.
of those
Okay.
chronic illnesses.
Okay. Okay. Please continue.
So the reason I picked the five horsemen
Hmm.
was to represent the big market forces in the United States that keep people unhealthy, that
Okay.
make people unhealthy.
Mm-hmm.
So here they are. It's, I call the medical industry,
Mm-hmm.
and notice I use the word industry now
Okay.
instead of profession.
Mm-hmm.
The medical industry is, I call it a disease manager and
Mm-hmm.
a not so silent killer.
Mm-hmm.
Here's the wonderful, not so wonderful actually, but very accurate statistics by a very august institution.
Mm-hmm.
And here it is. It's Death in the United States. And it's from Johns Hopkins University,
Mm-hmm.
from their medical school. Now,
Mm-hmm.
that's one of the great medical institutions in the United States.
All right.
And it came out with an article and a chart that's on page 7 in the book
Mm-hmm.
that shows that medical error is the third leading cause of death in the United States.
Mm-hmm.
So heart disease is first with 600,000 deaths a year.
Wow.
Cancer has another approximate 600,000 deaths a year.
Mm-hmm.
And then third is medical error with over 250,000 deaths a year. Now
Wow.
that means that something is really, really wrong with the medical industry.
All right. So
So
let me just clarify. Medical error. Are we talking stuff like, operating equipment being left inside the patient's body? Are we talking about being diagnosed incorrectly? Is that what you're talking about?
we're talking about all those things, mistakes in medication, wrong combination of medications, all of those things.
Okay. Okay.
And And then the second one, if since we're talking about medication, is who I call big pharma, or some people call big pharma, the
Mm-hmm.
pharmaceutical industry, and I've characterized it as a robber baron.
Mm-hmm.
We recently had in the States this man who's now in jail, Martin Shkreli,
Mm-hmm.
who acquired the U.S. rights to Daraprim,
Mm-hmm.
a drug that treats a parasite that's dangerous to pregnant women.
Mm-hmm.
And he jacked up the price of a single pill more than 5,000%, from $13.50 to $750.
Wow.
And he refused to apologize. He compared himself to John D. Rockefeller,
Mm.
saying he would never apologize as long as what he was doing was legal.
Mm-hmm.
And to say more about prices, drugs cost excessively more in the USA than in other countries. If you look right on page 10 in the book,
Mm-hmm.
the anti-inflammatory Celebrex, which many people need for arthritis,
Mm-hmm.
costs $330 in the US,
Mm-hmm.
$51 in Canada,
Mm-hmm.
$121 in the UK, and $164 in Spain.
Wow. Okay.
That's roughly between 3 and 6 times more than in other countries.
Right.
Copaxone for MS costs $3,900,
Hmm.
and in Canada, $1,400. In the UK, $862. In Spain, $1,191.
Mm-hmm.
And I could go on. I won't belabor the point, but that's only to say that's why I say that big farm functions as a robber baron.
Mm-hmm.
And then the next horseman is big food.
Mm-hmm.
And I call big food a sugarholic,
Mm-hmm.
an addictive, obsessed huckster. And the reason for that is that big food is responsible, I think, in a big way for the obesity epidemic.
Mm-hmm.
And here's how. Let's just go back a few decades to the sugar industry.
Okay.
And the sugar industry, I think, is central to the steep decline in public health in the United States in the last 50 years. And there's documentation of this.
Mm-hmm.
The prestigious medical journal JAMA published an article in its September 12, 2016 online issue with documentary proof that in the 1960s, an industry group called the Sugar Research Foundation,
Mm-hmm.
knowing in the knowledge that sugar was a principal cause of coronary heart disease,
Hmm.
paid scientists to point the blame at fat. And in
Okay.
my opinion, this cover up has been one of the biggest factors in ruining the health of the last 4 or 5 generations of America.
Mm.
So it's a deliberate, dishonest scheme.
Mm-hmm.
We're in the middle of heart disease, diabetes, and obesity epidemics.
Mm-hmm.
Children are developing middle-aged diseases,
Mm-hmm.
type 2 diabetes, high cholesterol, and high blood pressure.
Mm-hmm.
So, you know, from the 60s on, the entire manufactured food industry fell right in behind the sugar industry and used every marketing trick in the book to convince everyone that low-fat snacks loaded with sugar and trans fats would be healthy.
Mm-hmm.
And in my lifetime, cola drinks, which were once sold in 6-ounce glass bottles,
Mm-hmm.
are now in giant plastic 32, which is a quart, or 64, a half-gallon ounce bottles.
Mm-hmm.
And foods with a healthy profile, like yogurt or oatmeal, have been hijacked and marketed with sugar loads higher than sugary cereals or sodas.
Mm-hmm.
And the thing is, the food industry, the reason why I say it's an addiction master is because if you look at the wonderful book, Salt, Sugar, Fat, it documents that the food industry is in the business of making foods deliberately addictive.
Mm-hmm.
So that's the second horseman, big
Right.
food.
Right.
Now, or I'm sorry, the third horseman, big food.
Right.
Then there's Big Ag, and I call it the master of chemical attack strategies
Mm-hmm.
because Big Ag and its chemicals and its antibiotics that they feed the animals have
Mm-hmm.
caused antibiotic resistance to really bad microorganisms, bacteria, and made it so that when you get treated in the hospital, you're going to die anyway because these people have been putting antibiotics in your food for a couple, 2, 3, 4 generations.
Ouch.
And yes, ouch is right. And one of the chemicals that Big Ag has been spraying on your food is chlorpyrifos, which is a chemical of a class that was originally developed as a nerve gas. It's been
Okay.
so widely used that a 2012 study found chlorpyrifos in the umbilical cord blood of 87% of the newborns tested in an agricultural community.
Wow.
And why is that so bad? Because chlorpyrifos has been proven to cause brain damage in children,
Mm-hmm.
which is not a big surprise that a nerve gas chemical would cause brain
Right.
damage.
Right.
So I think that that covers at least some of the worst of Big Ag. And then there's Big Pol, big politics.
Mm-hmm.
And I call big politics profit mad healthcare demolition expert.
Mm-hmm.
And I know uh, that that's true because big politics has been witnessed repeatedly trying to destroy healthcare coverage for at least 23 million people. I'm sure you've read about that in the international news.
Yes, I have.
And, yeah. And actually, it has been destroying healthcare in specific ways, like being part of the opioid epidemic.
Mm-hmm.
Actually, the thing is, the big pharmaceutical, big pharm,
Mm-hmm.
has bribed Big Paul to vote their way and to have inadequate punishments for selling these opioids to drug mills who get them out to huge numbers of people.
And of course, these opioids, I mean, they eventually turn people into addicts. Is this not correct?
That is correct.
Hmm.
So that's a pretty good uh, characterization of the market forces that affect people's individual health.
Hmm.
But I think it's important to talk about the medical system that has responded to that, I think, in a kind of old fashioned knee jerk way.
Hmm.
I think our diagnostic system is broken
Okay.
because here's what happens. The medical system right now, or big med as I call them, or the medical industry,
Hmm.
is in the business of describing, calling this diagnosis.
Hmm.
So they say, okay, you come into your doctor and you say, okay, doc, my bowel is irritated.
Hmm.
I have an irritated bowel.
Hmm.
Now, to diagnose that, in my book, you should say, okay, let's find out what's causing that irritation, right?
Right.
But no, what they say is, oh, okay, well, you have irritable bowel syndrome. Here's your drug.
Hmm.
Now, that's just not right.
Hmm.
You know, if you think about it, you could say to your doctor, wait a minute, irritable bowel syndrome? Doc, that's what I just told you.
Hmm.
My bowel is irritated. Now, tell me why. And unfortunately, they don't usually do that.
Hmm.
They just want to assign you to a category
Hmm.
that they call a diagnostic category,
Hmm.
and then either do the drug or drugs or procedure that matches that category. Well,
Hmm.
that doesn't help. And if it did help, why do we have these 6 out of 10 people that have at least one chronic illness and a third of our population that's obese? I guess you'd have to use the phrase, hey, how's that working for you?
Right. So
You
this,
know?
yep. So this, categorizing a patient into certain, like irritable bowel. I mean, that's just it. Does this have anything to do with the idea of a clockwork mechanism for the human body? Where the specialists focus only on one part and curing that part is all they have to deal with?
Yes, if you divide up what's actually the human body's an ecosystem,
Hmm.
it's all interactive and it is also interacting with the larger ecosystem, which is everything from the air in your house and outside to the food that you eat. And so, everything, what's going to go wrong if you're only focusing on, let's say, your heart and not the rest of your body? Well, what's going to go wrong is everything.
Hmm.
And what I want to focus on at this point is how do you make this go right?
Hmm.
And it sounds pretty simple, but it is. You treat a whole system, a holistic system, holistically.
Hmm.
Wow, shocker, right?
Hmm.
So, and I want to give an example of somebody who has had the brilliance to treat a holistic system holistically
Okay.
and has gotten spectacular results. And I've described this in the book on page 55. It's about Alzheimer's
Hmm.
disease. And this person, Dr. Dale Bredesen from UCLA, who did a groundbreaking study about Alzheimer's, treated it holistically. He
Okay.
got his spectacular results by having people do a number of things. The original study was called Reversal of Cognitive Decline,
Mm-hmm.
a novel therapeutic program. And it was published in the journal Aging by Dale Bredesen, MD, director of the Alzheimer's disease program
Mm-hmm.
at UCLA's David Geffen School of Medicine.
Mm-hmm.
Now, since then, Dr. Bredesen has written a brilliant book called The End of Alzheimer's,
Mm-hmm.
which I would recommend that everybody read.
Right.
Because why not start doing his program when you're in your 20s or 30s or 40s? Then
Right.
you never get Alzheimer's.
Right.
And you don't get a lot of other diseases either. So here's his program, and just listen to how holistic this is.
Mm-hmm.
It deals with food, sleep, your dental hygiene.
Mm-hmm.
It deals with your eating pattern, your stress, your exercise.
Mm-hmm.
So this is important. I just want to read this because, and part of the reason is this is the same kind of program that I'm using, describing, and advocating in the book.
Mm-hmm.
So here it is. This is what the Alzheimer people did. And let me first say the punchline. The punchline is that most of the people, and they had all had to quit work because they were that far into Alzheimer's.
Mm-hmm.
6 out of 10 of these people went back to work
Wow.
after doing this program.
Wow.
Okay, so here's the program. Eliminating all simple carbs, gluten grains, all other grains, starches, and sugars,
Mm-hmm.
and all processed foods from the diet.
Mm-hmm.
So there you go. Eat real food and eliminate the starches. That's pretty simple.
Right.
Then increase consumptions of fruits, vegetables, and non-farmed fish.
Mm-hmm.
And the third one, follow a strict eating pattern with a minimum of 12 hours fasting between dinner and breakfast,
Mm-hmm.
and a minimum of 3 hours fasting between dinner and bedtime.
Mm-hmm.
Wow, you mean you don't go to bed on a full stomach? Shocker.
Mm-hmm.
Of course you don't, but people have forgotten that. They're constantly snacking, and the constant snacks tend to mostly be junk food.
Mm-hmm.
Then the fourth one is improve oral hygiene using an electric flosser and electric toothbrush.
Mm-hmm.
Our establishment acts like dental health and general health, medical health, are two different things.
Mm-hmm.
You know, your teeth aren't just sitting there in your mouth, not doing anything, or like George Washington's wooden teeth.
All right.
That's not what's happening. They're leaching infection, if you have gum infection or poor hygiene,
Mm-hmm.
into the rest of your body.
Mm-hmm.
Your dental health can be the direct reason why you get a heart infection, like one that they call subacute bacterial endocarditis.
Mm-hmm.
Your teeth can have cause infection in your brain.
Mm-hmm.
So that's number 4, improving oral hygiene using an electric flosser and an electric toothbrush. Number 4, sleeping for at least 7 or 8 hours a night.
Mm-hmm.
Number 5, exercising for a minimum of 30 minutes, 4 to 6 days a week.
Mm-hmm.
And then decreasing stress by meditating twice a day and doing yoga. Then, where appropriate, women do a hormone replacement therapy, and that would be a bioidentical one, not the usual hormone pills.
Right.
And then, last but surely not least, taking supplements, including melatonin, B12, vitamin D3, fish oil, coenzyme Q10, and probiotics every day.
Mm-hmm.
So this is a campaign that's run on a lot of fronts. diet, exercise, and stress reduction, and dental health, and sleep,
Hmm.
and vitamins and minerals. So, this is something that happens in a lot of places in your life, and it's something that you do.
Hmm.
Well, for some people, they may think that's bad news. Oh, I really have to get up and do something.
Right.
I can't just be a couch potato and watch TV and eat my popcorn.
Hmm.
But on the other hand, it's good news because there's something you can do, and it's so powerful. It can even reduce diseases like Alzheimer's that were thought to be just due to aging and totally inevitable.
Hmm.
Well, it turns out it's not.
Hmm. All right. And what strikes me here is that, it's not like the conventional thing of, say maybe looking for a sort of Alzheimer's so you can create a pill to counteract Alzheimer's. No, this is all about lifestyle. This is all about diet. It's the entire thing. It's the entire package.
Yes, and the other thing is back to the punchline, it works.
Mm.
Whereas there hasn't been a single drug that has done really anything to even very much slow down and certainly not reverse Alzheimer's. So, this is the best argument right here
Mm.
for holistic health that I've ever seen. And I'm so thrilled that besides the study that he did, Dr. Bredesen wrote a whole book that's available to everyone. And I would recommend that people read both my book and his book,
Mm.
and another book called Grain Brain
Mhm.
by David Perlmutter that talks about the effects that grain can have on your neurological system,
Mm. Okay.
how they can give you brain fog and everything else. Grains are a real problem.
Mhm.
I don't believe that we were evolved to eat them in the first place.
Mhm.
We were on a more hunter gatherer diet for so much of the evolutionary time that we've been around
Mhm.
that we're still better adapted, I believe, to that diet,
Mhm.
which is mainly hunter gatherer. If you can't pick it, pluck it, gather it, or hunt it, don't eat it.
Right.
So that's pretty simple. You eat um, meat, fish, chicken, and of course, organic, clean versions of
Mm.
all those.
Right.
If you're a vegetarian, I'll describe in a minute a way that you can do this diet as a vegetarian
Mhm.
and even a vegan.
Mhm.
So it's really a diet that's simple and that's for everyone.
Mhm.
One of the reasons I picked paleo is how wildly successful it was for me and my patients,
Mhm.
the and also the evolutionary aspects to it.
Mhm.
And last but not least, it's easy
Mhm.
and you're not hungry. The higher fat content and the low carb content and the good protein content
Mhm.
keeps you from being hungry. And you can lose weight on this diet
Mhm.
without calorie counting. So that's basically the diet that both Dr. Bredesen and I advocate. It's a very healthy diet. It keeps you vital. It's easy. There's paleo diet recipes all over the internet
Mhm.
in the United States and every place else.
All right.
It's so simple to do.
Cool.
And then let's talk a minute about the exercise aspect.
All right.
Exercise can be so easy. It's and I'm going to call in another doctor on this one, Dr. Al Sears,
Mhm.
who has put together a wonderful interval exercise program called the PACE program.
Hmm.
And it's on DVD. And that's one that I do. I walk, I swim, and I sometimes do chair yoga. I
Hmm.
do Tibetan yoga,
Hmm.
and I do Al Sears PACE program.
Hmm.
And why is it so wonderful? It's interval exercise that speeds up and slows down your heart.
Hmm.
And that's really one of the best types of exercise you can do. And you get more bang for your investment of time. You
Right.
can do that for 12 to 15 minutes, 4 times a week. And that's pretty much the only thing you necessarily need to do.
Right.
And there's even a no impact version of it, which of course I need because of my previously broken neck.
Right.
So, exercise, people, I think, make it too hard in their mind. They think, oh no, I have to go to the gym. I
Hmm.
have to do all this stuff. I can't do that. I'm not an athletic person. That just doesn't apply here.
Okay.
And that's part of what's in the book is you can exercise and you can do it easily and keep yourself a whole lot healthier.
All right. Cool. So, Dr. Howard, I know you've got a lot more to say, and for all that, I would refer our listeners to your book. Buy it and check it out. But in the last minute or so of this interview, Dr. Howard, what would you like to have happen at the end of all this?
I would like public health in America to turn itself around, and I'd like to see the generation of my grandchildren be as healthy as the adults were when I was a kid in the 1940s.
Hmm. All right, cool. So, yeah, that's a great goal to shoot for right there. So, in closing, then, the book is Alive and Well: Your Survival Guide for the Healthcare Apocalypse. The author's our guest, Dr. Martha Howard, and she's got a lot to say in the book, so check it out. Dr. Howard, thanks again for being an author story. It was very informative, and it really puts a whole new spin on the healthcare issue in the United States.
Thanks, Alex. I really appreciate it. And thanks for all the great questions.
You're welcome. So again, everyone, I invite you check out Alive and Well on the Amazon link below. It seems like it's a very informative book, and you can also subscribe to our channel if you want. So see you guys next week on our Author Story weekly interviews with another amazing author.